Tonight, failing, overburdened, and outpaced by COVID-19. That is how some are describing the state's contact tracing program. ABC 27 investigator Katie LaGrone has a look at where the program stands and why the state is still revealing so little about its efforts.
Touted as a major weapon in the war to stop the spread of the COVID-19 virus, Florida's contact tracing program remains an active part of the state's battle.
Has contact tracing gotten any better in Florida?
No, it hasn't. Contact tracing still remains one of many weak points in our approach to this pandemic.
And statewide details appear to still be shrouded in secrecy. Despite repeated requests for basic information, including current number of tracers, success rates, and program details, the state's Department of Health has yet to provide us answers. So we asked cities and counties.
Almost nothing has been done to tell people what this process is about,
including Miami Beach Mayor Dan Gelber, who has been an outspoken critic of the state's overall response to the pandemic since the beginning. Contact tracing, no exception.
Unfortunately, deja vu, because it happened precisely like this over the summer, and we didn't even have enough people to make the calls at that point. Now we just have a terrible program.
His city and county, Miami-Dade, remains an epicenter for positive cases, deaths, and a constant surge.
When you don't have contact tracing, you have the surge. That's exactly what's happening.
In state draft reports about Miami-Dade County he provided to us, over a 2-week period in December, less than half the number of people who tested positive were interviewed by a tracer within 2 days.
We are not even reaching 50% of those infected on a daily basis.
A week or so before Christmas, that's a tough time to contact trace.
I look at them every 2 weeks, and it's not been better previously.
We asked the state for copies of all Florida county contact tracing follow-up reports going back to November 1st. Its response, our request is currently being processed.
At this point, we see real challenges with operationalizing contact tracing across the country because of a couple different factors, one of which is just the surge.
Adrian Casalati of the National Association of County and City Health Officials says the surge, coupled with individuals' refusal to cooperate with tracers, has left state contact tracing efforts around the country struggling to keep up.
There are just some places that aren't even attempting contact tracing to certain levels at this point, depending on how their community spread is going.
Florida is still working with an outside firm to contact trace, paying a total of $70 million over the next year, according to the state's government contract website. In this email, a spokesperson for the company stated, Maximus continues to support the state in their contract tracing efforts, and we are working closely with the Florida Department of Health to provide any support they need to address the current COVID-19 cases in Florida. What that means and how it's working, like contact tracing itself in Florida, remains a question we've repeatedly asked, but the state has yet to fully answer.
I've thrown my hands up many times. I'm well past the point of disbelief.
County health departments we contacted also wouldn't disclose details, referring us instead to the state. Katie LaGrone, ABC 27, investigates.